PIP joint, which is the middle knuckle. Okay, all right. And you're just shooting straight in. Make sure there's evidence of collimation. Unlike the thumb, you don't have to get the entire metacarpal, okay? All right, so for the oblique, okay, you're going to just kind of turn it in just a little bit, kind of make a C with their hand, and that's going to put it here. Now, if you want it in a complete, so that the joints will not be closed, you are going to put your thumb, however you do it. You're going to have to do it this way, okay? The other way just creates less OID, okay? So if this is the case and you're going to do it this way, then what do you need to do? Increase your SID. That is correct. Okay? So that the detail is still in there. Just put.
Can we put the marker up here? Would that be okay?
Well, you can, but it's going to magnify it, and I don't want it to magnify over the body part. So right here, I've got enough light. Okay? I'm putting my marker right here. Okay? All right, so now she's going to do her lateral, okay? We'll probably go medial, okay? All right, so just turn that finger in just like that. Put it right in the center. It's still in the center of the film, okay? And I have not had to collimate or anything. Now, don't forget to bring this back down, okay? When you raise that up, it's going to make the light look bigger, obviously. So when I brought it back down, I wanted to make sure that I was not in any anatomy. And that is your lateral finger for the second digit, okay? Now, let's do the fourth finger, okay? Same thing. You're going to center to the PIP. Make sure it's in the center of the film, okay? Right marker. Okay, now for your oblique, this one is not as far up as the second digit, so you won't have to raise it as much, okay? But you raise it just a little bit, not much. Okay? Now, yeah. Okay? Just make sure it's at the same centering, okay? You don't want anything overlapping. That's why you're using this block. Okay, so that's your oblique. This really should not take you very much time at all to do. I mean, just and then however you're going to do, you know what I'm saying? It shouldn't take you very long. You shouldn't have to really go, don't know what I'm doing. Okay, all right, so let's do your lateral. Now, so this one's a little harder, okay? And she can do that right there. Now, if you've got a popsicle stick or something like that, or a tongue depressor, you can use that. It's fine. If you don't have anything, it's fine like that, okay? It's not like it's a big, it's still in the film, and it's still in the light field. So it's still centered right here, okay? Now, if you want it in a perfect lateral, then you're gonna use this thing again. But this will be okay, because it's not going to close the joint spaces up unless their finger is like down, okay? You'll want to see some of the hand. You don't have to have the whole thing, okay? As we call it, the distal 1/3 and the proximal 1/3, okay? All right, marker. There's your marker. It is not in the anatomy. It's not in the soft tissue. It's not in the shadow. It's still in the center of the film. Okay, now, again, just mid-carpal. All right, then you're going to roll it up just a tad. Look, I didn't have to move anything. I just rolled her arm just a little bit, okay? That's all I had to do, okay? All right, now, that's the oblique. For the lateral, you're going to put it on its side, and as soon as you put it on its side, you're just going to move it backwards just a tad. Just like that. I didn't have to move my marker or anything. You just are taking it from here and just moving it back just ever so slightly. It just puts that radius and ulna right on top of each other, okay? All right, so that's that one. Now, we're gonna put it back down, and for the scaphoid view, okay, you're gonna have them rotate their hand. You're gonna do ulnar deviation. You're going to center right over the scaphoid, okay? Pretty much, she's already there. Again, if you've got a patient that, you know, knows what they're doing, helps. I don't feel like I've got enough room right here on the lateral side. So I'm putting it over here where I've got more room, okay? What you're doing with this is elongating the scaphoid. Then you're going to angle 10 to 15. You're going to place it right, the CR, which is the central ray, right over the scaphoid. Put your marker right there, and that will elongate the scaphoid for the scaphoid view, okay? The forearm and the elbow have to be at shoulder level. Your patient may have to lean, okay, if they can. If they can't, then you've got to build this up so that it's shoulder level. You will just have to move this. So make sure you take your angle off. Okay? Because this is a long bone, what do we have to include? Both joints. Where do we center? Mid forearm. Okay? Now, I've got a little more here, so I'm going to scoot her forward just a little bit. Okay, so I know that I've got both joints on there because I can feel her epicondyles and I can feel her styloid processes, okay? You're wanting to do an AP forearm. Why do you not do a PA forearm? They cross over each other, the radius and all the crossover, that is correct. For your marker, the R goes up, the fingers, okay? It goes up in the same direction of the fingers. Make sure it's not in the soft tissue. So whichever one you've got more light on, then put it there, okay? All right, so that is your AP forearm. Now, for her lateral, okay, still has to be at shoulder height, okay? This one's a little more difficult. So she's just going to rotate her forearm. You want to rotate your cassette, okay? Finger up or thumb up. There we go. Make sure it's at a 90-degree angle. The arm is at a 90-degree angle. There we go. You've got to watch here because you want to make sure that the elbow is not cut off here, okay? So if you've got a little more of the wrist, you can scoot it forward just a little bit. Still, the marker is going towards the fingers, okay? Now, we can't collimate top to bottom, but we can collimate side to side a little bit. But don't forget, you don't want to cut any of this off because that is part of the forearm, okay? Just giving you a thumbs up, basically, okay? All right, so there is your lateral forearm. Okay, next is the elbow. So here she's getting repositioned again. Okay, again, we're going at shoulder level, okay? All right, this might be a little more difficult just because she's a little bit, she's a little crooked. All right, so where are we centering for this? Mid elbow, just right in the center. Just right in the center. And again, how much of this do we want to see? Distal and proximal 1/3. This is your AP elbow. It's still in the center of the cassette. This right here is not as a big deal because it's not in the pertinent anatomy, okay? Your marker is going up the humerus. You see that? Okay, now, we do 4 views on the elbow. The next one we're going to do, since she's already in this position, is an external rotation. So she's rotating it this way. Okay, what is that looking for?
It's looking for the radial head.
The radial head. Yes. Okay, again, you come behind your patient. If they look like they're going this way, just come behind them and straighten them up. Literally, I didn't have to do anything. All she did was roll over some. Don't really have to move her that much. Make sure your marker's up the elbow. There's your external rotation. Now for the medial rotation, take your hand and arm. Some of them, you have to take the whole thing and roll it. We remember from this, where my elbow was like this and then it stayed like this. You definitely want to do this so that there is a 45-degree angle going this way, okay? This is your medial rotation. You may have to move it just a tad, but it's not gonna be much, okay? And then there's your medial rotation of your elbow. Now, you're gonna do your lateral. She's gonna bend her elbow. It's in a 90-degree angle. You're going to center. Again, still the same place. That looks good. And the marker is still going up the humerus. Okay? So if you can't get it on this side, then you can put it down here. It's fine. But right here, she's got plenty of light. And there's nothing in the way. And there is your lateral elbow. Again, thumbs up. Okay? All right. That's it.